Thank you so much, Stan. I'm very honored and thrilled to be here. So as Stan mentioned, I'm Amrita Roy. I'm a family doc and also a health researcher at Queen's. I'll say first of all that I am not Indigenous. I am a settler, but I strive to be an ally. And one of the ways that I strive to do that is by working collaboratively with Indigenous peoples in community-based OCAP-centered research that is driven by the community and that meets the needs of the community. So I was doing that previously in Calgary, Alberta, where I was a doctoral student. And then in the last 3 years that I've been working at Queen's, I've had the deep honor to work with the Kingston area urban Indigenous groups in that type of work as well. And so I'm going to share my screen. Just see here. Let's see if the technology works. I think we're okay. Sorry, let me put this into presentation mode. Come on.
We can see the screen moving around, Amrita. You're good to go.
Okay, sounds good. Excellent. So the project that I'm going to be talking about today is actually the first project that I've had the honor to work with the Kingston area Indigenous community with. And as I'll mention in the latter parts of the presentation, that it's a relationship that is continuing, which I think is very powerful, and I'm very honored to be a part of that. So I'm going to be speaking about the Gadaraqui Indigenous Resilience during COVID-19, or KIRK-19 project that we came together to do. And so I'll offer a bit of background on the project. I'll speak about the partnership and how we approached the OCAP principles in the context of this work, and then give a bit of an overview of the project, share some results and recommendations that came out, and also end with some of the work that we're hoping to continue to do together as a result of the partnership that really came together in this first kind of project together. So as I'm sure everyone in this audience knows, Indigenous peoples in Canada do have higher rates of chronic health issues, and that is directly related to social disparities and barriers to accessing services, which in turn are related to the ongoing impacts of colonization and racism. And COVID-19, when that pandemic hit in 2020 and is of course continuing, that created additional challenges with regards to socioeconomic factors, social well-being, access to services. So it was sort of this additional intersecting layer on top of challenges that were already facing Indigenous peoples in Canada. Despite these challenges, however, it's really important to highlight that Indigenous individuals and communities also have remarkable strength and resilience in the face of challenges. Certainly, COVID-19 is not the first curveball that Indigenous peoples have successfully faced. And so it's important to take that strength-based approach and to also highlight where that strength comes from. And that includes factors such as traditional culture as a powerful force for wellness, and also from a traditional worldview that values strong relational community connections and allows community to come together to overcome some of these challenges. So the KIRK-19 project, it was a project that sought to understand experiences during the COVID-19 pandemic of Indigenous peoples living with chronic health issues, and of service providing organizations that serve such individuals in the Kingston and Southeast Ontario area. And the KIRK-19 team sort of involved a number of people coming together, and even like the initial conversations that launched this project, it was really about people coming together and saying, you know, what would be meaningful to do now that we've got this pandemic playing out. And so the team involved Indigenous community members, community service providing organizations, as well as academic researchers from Queen's. And we all came together in this partnership to do research in a way that we hope is ethical, respectful, culturally safe, and ultimately useful and beneficial for Indigenous peoples. And so OCAP, as many of you know, it's an acronym that stands for Ownership, Control, Access, and Possession, and it's a set of principles that were advocated for by First Nations groups in Canada to really highlight the importance of ensuring that any research done about Indigenous peoples is done by Indigenous peoples in a way that's community driven, that's self-directed, and that's ultimately meaningful for the community. And so we strove to keep those principles at front and center in the approach of this research. And I'll highlight that this project, even the idea from the project, really came from the community. It really was a ground up endeavor. And so as the idea gained momentum and we brought more players on, We got partner agencies in the form of the Southeast Regional Cancer Care Program, the Indigenous Cancer Care Unit, the Indigenous Diabetes Health Circle, of course, the Indigenous Health Council, Street Health, KFLNA Public Health, and Addictions and Mental Health Services of KFLA. So a great group of partners and members from each of these agencies, plus community members, and then us academics from Queen's University, we all formed the team together. Additionally, we had an Indigenous Oversight Committee of Ashka Bewitz, which is this beautiful concept that I learned about, and this word that I learned about in the context of this project, which I understand means helpers and knowledge keepers from the local community. These amazing people helped to ensure that the research was done in an ethical way and in a way that would be meaningful for the community. And the governance process that allowed that community voice to be embedded in all aspects was through the form of kind of regular meetings and ensuring that a collaborative approach was taken to all steps, right from even the conceptualization of even having this project, to the design and protocol behind it, to right down to the interview questions and the materials that were used to collect data, the analysis and interpretation. We had some great group analysis sessions that were really powerful to help understand, what we were hearing and what it meant. And then even finally the dissemination products, which is sort of an ongoing process, but it was very much a collaborative process that was very powerful. And I will take a moment just to read out some names, because I think it's really, really important to highlight the amazing people who have been working on this. So apart from myself, we had Caitlin Patterson, who was the research associate. She's was a grad student at Queen's at the time of this. And then I'll list a few, I'll list the other names as well. Dion Nolan, Dr. Amanda Shepard, Autumn Watson, of course, from IDHC, Mireille Lapointe, Laurel Claus Johnson, who we recently lost from this region. We think of her today in sharing this work that she was a part of. Deb Satamon, Kathy Brandt, Michigan Vernon Alteman, Fran Chesson, Sheldon Travis, Dr. Sarah Funnell, Dr. Colleen Grady, Dr. Iman Bayumi, Dr. Michael Green, Dr. Meredith McKenzie, Sheila Rowade, Sean Preston, and Susan Stewart. So all amazing people who made this project possible. So the project had two broad components. I'm going to be focusing today on component number one. Component number two, we're still sort of working through some of that data, but component number one is done. The report has been released. If anyone would like to receive the report, please shoot me an email that I have on my last slide, and I'm happy to send those PDFs to you. But the first component sought to understand the experiences of Indigenous individuals living with chronic physical or mental health issues with respect to access to health and social services with the onset of the COVID-19 pandemic. And the second objective was to understand the impact on holistic well-being of COVID-19 related stressors in Indigenous individuals who were already coping with chronic health issues at the time that the pandemic started. The second component was looking at the experiences of Indigenous focused service groups as they work to meet their mandate amidst the onset of the pandemic, and also to highlight some of the alternative program delivery methods that were used by these groups with the pandemic's onset. So again, I won't be focusing on this, that work is still ongoing, but I'll focus on the first component instead. And across the components, the overall aims of this were really to identify areas of need and opportunities for intervention for Indigenous individuals living with chronic conditions, and also for Indigenous focused service groups who work with such individuals. We also really wanted to highlight the strengths, successes, and stories of resilience among Indigenous individuals and organizations in the region, and to encourage long-standing collaboration between partners and an overall approach of community engagement in all research done with the community, so it has to be by the community. So again, going back to the focus on the first component. So the method taken was called constructivist grounded theory, and that involved interviews with 22 Indigenous adults living with one or more chronic health issues. And those interviews took place kind of between fall of 2020 and the early part of 2021. And the interviews were analyzed, and we developed two frameworks, one for each of the two objectives in that component. So the first framework that I'll share is in regards to factors impacting Indigenous wellness, defined holistically during COVID-19 in the region. So in the interest of time, I won't go through sort of every aspect of what we heard, but you can see the framework that we pulled together identified 6 bubbles, I suppose, of factors that were positively and negatively impacting wellness during this time. So we heard about the social determinants of health, experiences in programs, services, and institutions, personal identities, culture and community, cultural and personal coping behaviors, and then community and personal relationships. And so I'm going to highlight just some broad findings from all that. There we go. So I'll start with some of the negative impacts that we heard about. Certainly it goes without saying that the COVID-19 pandemic had negative impacts on all aspects of holistic wellness. We heard about social and spiritual disconnection due to isolation. Again, we were doing these interviews sort of at that early phase when we were having those lockdowns and everyone was very disconnected. We heard about stress, anxiety, poor sleep, changes in diet and exercise patterns, and in some cases, particularly those with more significant trauma histories, increased substance abuse and self-harm. And we also heard from many people that they felt that there was a worsening of their pre-existing chronic health issues as a result of the pandemic. And some of the drivers of this worsening wellness was related in particular to cancellation of in-person community cultural events and ceremonies, which were such an integral part for people's wellness strategies and meaningful coping strategies, and these got canceled, so that was very hard. Isolation from friends and families as a result of some of the stay-at-home restrictions that were in place. Challenges in caring for children, elders, vulnerable family and community members. So that caregiver piece came up quite a lot. And of course, the socioeconomic impacts, particularly in those first lockdowns, job loss, reduced income, the stresses of having to homeschool kids and go through that remote learning process in the early parts of the pandemic. So certainly lots of challenges that came up and a lot of negative issues came up, but we also heard a lot of really powerful positive impacts as well. So we heard about positive coping strategies and meaningful ways to face the challenges that the pandemic offered. And one really powerful thing that came up was engagement with community and cultural practices and ceremonies in virtual and physically distanced forums. So when those virtual and safer options were offered, that was found to be really positive. And that was positive because engagement with these ceremonies and cultural practices enhanced a strong sense of personal and community identity, which then in turn fostered resilience through that strengths-based approach. Personal relationships and social support we heard about as well, spirituality, cultural practices, strength through identity, resilient personality traits, so things like optimism, hope, maintaining a sense of humor, things like that, and other personal coping strategies that allowed people to stay strong in the face of the challenges. So moving on to then the second sort of framework that came out of this first component, and that looked at barriers and facilitators to access to care for Indigenous peoples during COVID-19. So we have a diagram that pulled these together. And again, in the interest of time, I won't dissect every bubble on here, but I'll offer some overarching themes in regards to both barriers and facilitators. In terms of barriers to access, I think it's important to highlight, and I don't think this is a newsflash to anybody here, that there were barriers to access that pre-existed the pandemic. And in fact, most of what we heard about pre-existed the pandemic. And that included limited or lack of availability of services that were meeting needs, services that are easily accessible, and services and resources that are affordable. And of course, we heard, sadly, but not surprisingly, of experiences of racism and other intersecting sources of oppression in service systems, and as well as limited or lack of culturally appropriate and culturally safe services. Where the pandemic exacerbated things certainly is it exacerbated all of the above, and then also specifically resulted in things like longer wait times for services, canceled services. Virtual care came up as both a positive and a negative. So there were some aspects of virtual care that were negative, particularly wrestling with the technology piece and access to technology that served as a barrier to access. On the other hand, there were some facilitators and some things that were highlighted as facilitating access. So programs and services that address the social determinants of health were highlighted as very important and meaningful to help people sort of manage their chronic health issues in the context of the pandemic. Having programs and services that meet needs. Virtual care and the positive aspects of it, particularly negating the need to travel or to spend time and money to travel. And so that in some ways helped access as well. The importance of having safe spaces for Indigenous peoples, including notably Indigenous women and two-spirited individuals. That came up quite a bit. And then, of course, the value of Indigenous-led and Indigenous-focused programs and services by organizations, including the IDHC. And that was highlighted as a facilitator to access because these organizations and the services that they give are more likely to be culturally appropriate and to provide holistic care that may not be available elsewhere. And so from this first component, we had a pretty lengthy list of recommendations. And again, happy to share the report for anyone who would like to receive it. But in the interest of time, I'll select a few that came out that felt meaningful. So there was recommendation to ensure long-term adequate funding for community-based programs and services for Indigenous wellness. And in particular, programs that are run by Indigenous-led and Indigenous-focused organizations, because of, again, the powerful role that they have in meeting Indigenous needs in ways that other organizations may not be able to. The need for Indigenous-led physical spaces for people to gather, to practice culture, spend time with community, and to engage in ceremony, all as ways to enhance wellness. The hiring of traditional leaders, knowledge keepers, and elders in all spaces where healthcare is provided to Indigenous peoples was a recommendation that came out of this. And just even thinking even more big picture to systems level sort of recommendations, the importance of meaningful public policy to address the social determinants of health. We know that because of colonization and because of racism, Indigenous peoples face inequities along the social determinants of health. And so a lack of meaningful public policy will differentially impact Indigenous peoples. So meaningful public policy that addresses financial insecurity, housing insecurity, food insecurity, and the like. And then at a service level and a service system level, the importance of relational, community-based, culturally safe and appropriate, and also patient or client-focused care approaches in healthcare settings. And so that really goes into the health policy realm and also the health service execution realm as well. And so just in the last kind of minute or two, I just want to highlight that this was sort of the first project that I had the honor to be a part of in this local community. And it brought together several partners in a way that has endured, which I think is very beautiful and very powerful. So the community-based OCAP-centered approach used in Kirk-19 has resulted in these meaningful, enduring partnerships that have continued. And in particular, I'll highlight a couple of very concrete ways. So thinking about the recommendations that I mentioned, there were a couple that really spoke to the bigger picture of systems, health policy and health systems. And the partnerships that were forged during Kirk-19 were leveraged to create additional projects that we hope will address some of these recommendations. So we have a case study going on of the Indigenous Health Council, which is one of the partners from our region. We also have some work that we're doing in regards to centering Indigenous perspectives and priorities in the new Frontenac, Lennox, and Addington, Ontario Health Team. So these are examples of how the partnerships forged in this original study have endured and will hopefully allow us to continue to do good work together that will hopefully eventually bring about meaningful change. And so the note that I'll end on is just that the collaborative OCAP-centered partnerships that were developed hopefully have the potential to go beyond just this one project, but to advance Indigenous health equity more broadly and also to contribute to broader efforts of reconciliation in this region. So with that, I will say miigwech niawa, thank you so much for listening and for giving me the space to share about this project. I do have my email up there on the screen, and I would be delighted to hear from anyone, and in particular, if anyone would like to get the PDFs of those reports, happy to send that as well. So thank you again, and I'm happy to open whatever a few minutes that we have left. I'm happy to answer any questions if anyone has anything, or feedback or comments are always a welcome too.